Hey guys, welcome back. 3103. This is week 6. We're going to talk about ethics, values, and then we're going to talk about nursing theories. I know that's a little off topic from ethics and values, but this week in your paper, we're going to be discussing nursing theorists and how they can influence nursing care. So I think that's important we get that in with this lecture. We'll also discuss the paper a little bit towards the end. Make sure you're on the right page as far as that goes. But first, we're going to talk about ethics and ethical dilemmas that we might face within nursing and values and how our values are shaped. So I think you probably encounter ethical problems more than you even realize at work. It's probably frequent whether you are in an emergency room or a surgery room or even a clinic. Ethical issues come up within healthcare every day. So it's really important that we have ethical knowledge to have professional competence in nursing. Ethics is a branch of philosophy with an emphasis on morality. We're going to talk more about morality. It's a set of beliefs about the standards of right and wrong. So, what shapes what you think is right and wrong? It might be different than what I think is right and wrong. So, we're going to talk about values and how that shapes morality. So, what are some ethical issues that occur in nursing practice? And maybe think about something that you've came across or something you've read about, a situation you've been involved in, or someone you know has been involved in. You can pause the video, write some of those down. I'm going to take a second and I will share mine with you as well, what I wrote down. The first one I wrote down is end of life, really at any age, end of life. It can be an ethical dilemma, whether it's a young child who died suddenly, or whether it was 100-year-old woman who has a feeding tube and her family still has her listed as a full code. There could be ethical dilemmas in each one of those situations. I also wrote down abortion. You could be against it or for it. But at the end of the day, ethically, we have to educate our patients properly. We have to let our patients know the facts. HIV, I wrote this one down because I've had 2 students in the past who have come running up to me at clinical and said, Mrs. Gast, my patient has HIV. What should I do? Well, you should take care of them. You should honestly probably treat everyone like they have HIV. We should be wearing gloves. It's just standard practice. So I found that one kind of funny. Blood transfusions, that's another one from working in ER. This one came to mind. Anyone who is an acting Jehovah's Witness does not take blood transfusions. So that could cause an ethical dilemma. So those are some ethical issues. Those are big ethical issues. You can also have ethical issues around staffing. That's probably been something that's been an issue here with COVID um, because there's not enough staff. So patients aren't being properly taken care of. That can cause ethical issues. So here's some terminology that was at the end of your reading this week. Is at the very end. It talked about principle of healthcare ethics. So just respect for people, um, beneficence. I'm not sure if I'm pronouncing that right. So do good, non-maleficence, avoid harm, and justice, making fair decisions, privacy and confidentiality. These are things that you guys have all learned about. How do we resolve these ethical dilemmas? If you get intertwined within one of these ethical ethical dilemmas, how are we going to deal with it as a nurse professionally? Because as a nurse, we have the responsibility to be advocates for our patients. So being um, ethically competent, I guess you could say, is really important. So what classifies as an ethical dilemma? Well, you've got 2 or more choices available. Maybe it's difficult to determine which choice is best. Maybe there's no available alternatives, or each alternative may have both favorable and unfavorable features. So depending on what you're dealing with, um, there's different ways that you can go about resolving an ethical dilemma. Now, I love reading through these and the suggestions that they gave, because when I was looking at them, I was like, as a nurse, when we're presented with ethical dilemmas, do we really have time to conduct a case analysis and ethically respond to these situations? Not always, but I think it's really important to take a step back from the situation if you find yourself in that kind of situation, and maybe assess it. Try to get your feelings out of it. Talk to a mentor. Maybe what would you do in this situation, or if you're uncomfortable, have them come in with you as well. To help. Another thing to help with ethical dilemmas, maybe involve the family. If it's a situation that they could maybe shed some light on, that might be something that could help. As nurses, we obviously have to follow the code of ethics for nurses, the ANA code of ethics. So that's our duty as nurses. But we can also offer ongoing education in some of these situations, and it's really a case by case, scenario, what you're going to do in each situation. Values. I kind of mentioned this at the beginning. So values, it's something that we learn growing up. Values. I mean, when you think of values, think of something you do without even thinking. You put the grocery cart up without even thinking of leaving it in the parking lot, right? That's something I think of when I think of values. Values are learned. They're acted on without thought. How do we develop our own personal values? So here I've got personal and professional values. How do you develop personal values? Typically through socializing influences. So maybe family interactions, maybe you voicing a way that your parents have acted, and that's influenced your values. Or through school, maybe you had a professor in nursing school who was a clinical instructor, and they really carried themselves well, and that's how you model yourself as a nurse. Could be religious interactions, such as maybe you went to church, Sunday school, Wednesday nights, and that has a big influence on your values. Also, workplace and service interactions. We're going to talk more about professional values here, yes, on this page. So professional values, that falls under that code of ethics I was talking about. I'm sure you learned about the code of ethics in nursing school, the 9 nursing ANA code of ethics. I think there's 9 areas, if I'm right. I'm having a blank here. Yeah, nurse to patient, nurse to self, nurse to nurse, nurse to others, how you act in those situations. So that's really important as well. Sorry, my clicker's a little bit slow. Nursing theories. So we had some reading on nursing theories this week and theorists. And in the paper coming up, I want you to choose a nursing theory that you could possibly use towards your project. If it can't go towards your project, that's fine. I still want you to discuss a nursing theory and a nursing theorist. Nursing theories are really important to nursing, and they provide really the foundation for nursing practice. They're essential to the care of patients. They can help us evaluate care, base nursing interventions off of, or evaluations off of. They can provide rationales. They're really important, and I don't think we give nursing theories enough credit. There's 2 types of theories that were talked about in your reading. Grand theories, so those are less concrete, more less concrete and explicit. And then you've got middle range theories, which are narrower in scope. 2 of the theories I picked out to talk to you about today were Sister Calista Roy's adaptation model. I actually got to hear her speak at a conference in November, and she is unbelievable. I don't remember how old she is. She's in her 90s. She has done so much for the world of nursing, and to see her get up and speak in her 90s and still be so with it uh, and talk, it was really interesting. You should, if you have time, Google Sister Calista Roy and read about her. She's a very impactful impactful woman in the nursing world. So she wrote Calista Roy's adaptation model. It came out in 1971. The goal, I believe, if I remember right, she was a pediatric nurse when she wrote this. But the goal of this, um, within this model, is to promote patient adaptation. Um, in several areas. So it's an integrated level of adaptation for individuals that can advance wellness, quality of life, and even dignity with death. So in all of those situations, to promote adaptation for the patient. Her model focuses on 5 elements: the person, The goal of nursing, nursing activities, health, and the environment. So that's a very common, the adaptation model is a very common um, nursing theory. The other one I chose was Dorothea Orum's self-care deficit theory. This was written in 19. I'm not sure if I wrote that right. Was that 1971 as well? I was in your reading. It doesn't matter what the years are, because I'm pretty sure I just said Calista Roy was in 71. I'm not sure that I've got something wrong there. Calista Roy's might have been a different date. But anyway, neither here nor there. This is focusing on the patient's ability to perform self-care. So this theory can help nurses determine what aspects of care, of patient care, they should focus on in a given situation. And really, it stresses the importance of patients maintaining autonomy and self-care. Your reading goes into these theories a little bit more, but how can you use these theories with your PICO question is kind of what I was looking at for you guys to do. And if you can't, that's fine. I would still like you to talk about a theory and move on from there. I know the adaptation model can be used in a lot. I used it when working with diabetics, adapting to a new lifestyle. So that was something that was common. That's why I chose Calista Roy's, because I was familiar with it. But there are several out there that you can look at. There were several in our reading. Real quick, I want to take you over to what is due this week as far as the paper goes. So, purpose of the assignment is to state your PICO question and explore the literature. Several of you have emailed me your PICO question already, or you've written about your PICO question. I've given you some feedback. One thing I want to say about the PICO question is to keep it simple. We are not trying to save the world. We are trying to do something simple. So formulate your PICO question. Let's introduce the topic. If you come down here, additional instructions. Write an introduction about your topic. Include anything, history, statistics that you want to talk about. Use something you're familiar with. If you work in pre-op, use something there. I had a student once do a project on, this is not something you have to carry out right now, but they did one on adding hand sanitizers to we used to call them cows, computer on wheels, for nurses. Okay, so they went and found some articles, and it's simple. They went and found articles on having that as hand sanitizer available in different places and how that can affect nursing. So it can be something as simple as that. Formulate that PICO question and then research your topic. So find 3 evidence-based practice articles that support that. Yes, having hand sanitizer available on computer on wheels is a good idea. Having it available in different areas for nursing other than just at the nurse's station is a great idea. Articles really should be no more than 5 years old and from the United States. I prefer they be written by a nurse, but I'm not going to be super stringent on that. But make sure they're up-to-date articles. Other things I want to know: what does this topic look like 10 years from now? How do you see it changing with nursing? Identify a theory that interests you, and could this theory play a role in your clinical question? If it can't, just say this cannot play a role in my clinical question because, and explain. There is a rubric, so you can follow the guidelines on how to write your paper. It does need to be 4 to 6 pages long, not including the title and reference page. 7th edition APA required. So whatever questions you have about this, please email them to me. But I kind of wanted to introduce this to you at the end of the lecture so you kind of had an idea of what we were doing. Again, if you have questions, let me know. If I could be more clear about something, let me know about that as well. Thanks for hanging around today, guys. I will talk to you next week.